In our center, all of our work is about medication safety. We have 4 core projects in our center. One is about statistical methods for detecting drug risks in big databases. One is about teaching medical residents to give narcotic pain relievers more safely in the hospital. One is about drug name confusion errors and how to prevent them and how to detect them. And one is about providing better written information for patients who may have trouble reading and have low health literacy. One of our core projects involves trying to create better written information about medications for people who may have a hard time reading, who may have what we call low health literacy. And it's more than just not being able to read that fluently. In fact, many of these patients who have what we call low health literacy can actually read, and sometimes read quite well. So health literacy is more than just reading. It's reading, problem solving, calculating with numbers, making the right judgments and inferences about what to do and what not to do with medicines. And a lot of people struggle with this. In fact, very, very large numbers, tens of millions of Americans struggle with this kind of problem. And especially in an urban setting where our hospital is, where we have a lot of low-income patients, maybe patients with English as a second language, and a variety of other challenges, there are even more patients who struggle understanding the written information we give them. And frankly, the written information we give them is often very poorly designed and not at all patient-friendly. So this creates lots of problems for our patients because we give them information that's critical for the safe use of these medicines and they cannot understand it. And honestly, the majority of it gets thrown away. They never even look at it. So this is a critical problem for safe medication use. The doctor can very carefully choose the right medicine, can diagnose the disease correctly, then prescribe the medicine. We somehow get the medicine paid for, the patient can get it, and then they don't know how to use it safely. And often there's a lot of harm related to not understanding what the risks are and not recognizing the dangerous side effects that may happen, or not getting the benefit because they don't know exactly how to take it. So I'm going to let my colleague, Dr. Bill Galanter, talk about the more clinical aspects of this project and how we're going to try to introduce these more carefully designed written materials into the clinic so we can give patients written materials that they can really use.
And health literacy is a big problem to all clinicians. We try to make the right diagnosis. We try to give medicines in a judicious manner, and then patients wind up not able to do the complicated regimens that we give them. And doctors are very busy. I'm very busy in my clinic. The strategy that we're using to try to work on health literacy is related to the use of the electronic medical record and information in it, as well as experts in health literacy and development of readable materials to improve patients' ability to understand their medication regimens without giving a lot of work to the clinicians. So our system basically gives information to the patients about new medications that are started. We're particularly looking at diabetic patients that are on complicated medical regimens. And we also give them a medication list after they finish their appointment. And these materials are developed in a way that should make it easier for the average patient to understand what medicines we want them to take and when we want them to be taken. We give them a medication list at the beginning of each visit that helps them to explain to their doctor when they're not doing what the expected regimen is, or additional medications have been started between visits. And what we're trying to do is to study and see if this is actually going to improve outcomes such as control of diabetes, blood pressure, hyperlipidemia, as well as the patient's understanding of their regimens. And we picked this approach because this approach really doesn't need clinician input, which is something that's very difficult to find right now in the short visits that we have with our patients.